My name is Dr. Singh. I'm a regular family physician, restricting my practice to medical acupuncture. I was referred by a psychologist who used to work in our clinic, and this is Jack Poss. He's about 65, and he was referred to me for chronic pain of his lower back pain, for his lower back. He's had this for about 5-6 years. He's had a laminectomy in the back at about L4, L5, and in the neck for about C2 to T1, I think. I'm not quite sure because I don't have his records. He's also had bladder cancer that metastasized to the lung, and he's had right kidney removed. I'm not quite sure why. I thought it was because it metastasized to the kidney, but he says no. So I'm not sure. The other thing he has a pump on his left buttock to control his pain, and he came to me to see if I could reduce his pain.
You also mentioned he had Agent Orange exposure. Could you talk about that a little bit?
He has peripheral neuropathy secondary to Agent Orange. He was in Vietnam, and so I brought him. I called Dr. Starling to see if he'd be kind enough to take care of this patient, and I think he reluctantly agreed, and I'm so happy he did. The patient had a remarkable relief of his discomfort from level 8 to about level 2, and his wife was saying, as we were having lunch, that, my goodness, he's walking a lot, he's moving a lot better.
So right now, the pain you're feeling in the back, say on a scale of 0 to 10, when 10 is as bad as it gets and 0 is nothing, what would you say is that?
Back down
To an 8. I'm going to start with the root treatment, since Dr. Singh already said he's done symptomatic treatments and just had him feel worse. Ask your help. Just hold that for me right there, to the right of your belly button. And I'm going to go back here to bladder 23. How are you feeling? Any discomfort from this or anything at all?
No.
So nothing positive or negative, just neutral at this point.
I think the pain is decreased a little bit.
Pain is decreased a little bit.
So
Okay.
maybe,
Yeah, breathe deeply. Thank you for reminding me. Yes, so just try to breathe a little deeper while I'm doing this. So I'm really giving him a lot of this magenta light and polarized microcurrent through his kidneys. If it was an 8, is it still an 8 or is it a 7, or what would you say it is right now?
It's down a little bit. It's a
About a 7, okay. So now what I'm going to do is go back to purple light. Purple is used appropriate for lower back pain. Now I'm just going to rub up here. Tell me if any of these points up here are tender. Right there. Hashi. That one? Okay, the initial reading on the Accutron is 72. Between 72 and 80. Take some deep breaths into your belly, please. He's starting out at 40%. Deep breaths, please. That one way up from 40% to 90%, so that was a good one. You got a release of resistance there.
I think it's a little better. A little more pain down in the hip.
Now it's moved to the hip. That's a good sign. Now we're chasing the dragon. It went up to 90 and drifted down to 70. Oh, went right up to 100, drifted down to 90. Okay, one more time then. Check in with yourself again. Just wiggle a little bit. Tell me if it's same, better, or worse.
The positive was on the hip.
Yeah, positive was on the hip.
On the pain.
Yeah, positive on the pain, negative opposite.
Yeah, it's a lot better at this spot right there. And right up in here it's not so much, but right
Yeah, hip released a lot. Okay,
it's amazing how it's seeming to move from smaller spots to smaller spots. months.
Uh-huh. Okay, a little bit of conductivity around the sciatica point here. So take some deep breaths, please. Okay, do your Shen Men. Oh, that one went. Hear that one? Ooh, that's always a good sign when it does that. Okay, move again. Tell me, where are we? Say better or worse?
So it's better, substantially better. I'm impressed. I've had a lot of acupuncture. I've never had one respond like this before.
I'm really glad. Thank you.
Tell us what your pain level is now.
Yeah, good question.
Yeah, right now, just general pain level, I'd say is about a 2.
That's awesome.
Which for me is a rare thing.
Thank you, Dr. King.
So, this is a wonderful way to pull together all the stuff that you've been learning the last day and a half, because he definitely has some major challenges, but anybody can be healed.